Welcome to our in-service. I'm Carol Wooten and this is Angie Watkins, and we're presenting in-service on pelvic inflammatory disease. Another name for that is PID. And we just want to say that we welcome y'all and thank you for coming out tonight to be here for our in-service. The objectives, I'll go ahead and go over. The nurse will be able to identify what PID is. The nurse will be able to identify causes of PID. Nurse will be able to identify symptoms of PID. You will be able to identify testing for the PID and then also treatment for PID.
Okay. And now the agenda, we're going to explain what PID is, explain the causes of PID, explain the symptoms of PID, explain how to test for PID, and explain treatment for PID.
Pelvic inflammatory disease. PID, as we all know, is an acute infection of the uterus and fallopian tubes. If left untreated, PID can be very serious, causing scarring, adhesions, blockage of the fallopian tubes, and sometimes people can't get pregnant after they've had PID at a young age. PID is compromised of a spectrum of inflammatory disorders of the upper female genital tract, including any combination of endometritis, salpingitis, tubo-ovarian abscess, and pelvic peritonitis.
So what are the causes of PID? Well, there are a number of different organisms that can cause PID, but untreated sexually transmitted diseases is one. More than 50% of cases are caused by C. trichomoniasis and N. gonorrhea. Chlamydia, bacterial vaginosis, or having multiple sexual partners, or having a sexual partner that has multiple sexual partners. Being of young age at first intercourse, being of a lower economic status. Some procedures may even increase the risk for PID, such as pregnancy termination, IUD insertion, intrauterine insemination, and in vitro fertilization. Other non-sexually transmitted infections can also cause it. Also, having a history of PID inducing increases your risk.
Well, those are a lot. What are the symptoms of PID? People come in with severe lower abdominal pain, extreme uterine tenderness, ovarian tenderness, abnormal vaginal bleeding, which just means bleeding between their periods, unusual vaginal discharge, usually with a bad odor to it, pain and or bleeding during intercourse they may say they've had, burning sensation with urination, nausea and vomiting, fever and chills, usually really high spikes of temp like 102, 104. But then also the infected person could even be asymptomatic. That's not usually what we see in the hospital, but in the clinic or somewhere they might see that.
So, how do you test for PID? Well, PID is difficult to diagnose. So there is no single test that has an adequate sensitivity to diagnose PID. So a combination of medical history, physical exams, and other test results may be used to diagnose. A pelvic exam should be performed to check for cervical motion tenderness, uterine tenderness, or adnexal tenderness. Vaginal fluid should be tested for abundant numbers of white blood cells. STD test should be performed. A transvaginal ultrasound or even an MRI may be ordered, and an endometrial biopsy may also be performed.
So those are all good ways to find out. And the treatment for PID, treatment regimens must provide empiric broad spectrum coverage of likely pathogens. The most common antibiotics used, some of those include cefotaxime, doxycycline, and it mentions in the book that the doxycycline should be given orally instead of IV, and that way it helps decrease the IV pain, and it probably also helps decrease IV infiltration with all those medications. Another one is cefotaxime, clindamycin, gentamicin, ampicillin sulbactam, and metronidazole or Flagyl, as we all know. And that's about it. We hope y'all have learned something, and we really appreciate y'all coming tonight. We also have a evaluation sheet that we have to have filled out, and we would appreciate y'all going ahead and filling those out and turning them in as you leave. Thank you again for coming.